Your Health Matters program. I welcome everyone today on the 54th edition of Your Health Matters program. Today, I have a beautiful colleague on the program. Let me please join me to welcome my guest, Dr. Amy Morris Foreman. You're welcome onto this program.
Hello. Hi, Elizabeth. Thank you for having me.
So, for the benefit of people who are just joining this program, can you please introduce yourself to the audience, your clinical background?
Absolutely, yes. So I'm a counselling psychologist, and I've worked mainly within secondary care mental health, so more complex cases, working those that have difficulty with depression, anxiety, personality disorders. Also have experience with psychosis, and I also facilitate an anger management program.
Thank you so much. So this is actually for the benefits of our viewers that are actually joining us for the first time. So on today's topic, on the last program we did a caller coding, and the caller requested that we actually treat childhood trauma. And we all know that there is actually nothing that can be possible without a foundation. So we thought, let's go back to the basics. Let's actually share our experience. And like you all actually can see, my guest speaker today, Dr. Amy Morris, is well actually equipped in terms of this aspect. So, Dr. Amy, when we say what is childhood trauma, let's start with that.
Childhood trauma is obviously something that happens in our earlier years. And trauma itself is defined as something that is either actual or perceived threat of serious harm or death, either to yourself or to a loved one. But that's kind of sort of a very scoped definition, and the understanding has just grown and grown and grown. So you might hear the term childhood trauma, but you might also hear adverse childhood experiences, which perhaps, is a broader understanding. And it's anything that basically threatens the health or the well-being of the child or those that are supporting them and that they love. And within that, you have to think that this is something that we're thinking of as that happens to children. So it's anything that through a child's eyes would be deemed something that's threatening to them. So although we would think of the big ones as sort of physical abuse or sexual abuse or neglect, it can also be perhaps what some psychologists would term as smaller T trauma. So perhaps moving around a lot, maybe effects of sort of socio.
And I think the way you've actually just often, could have effects on a child. So
those other aspects of trauma that you might be exposed to. So that at school, perhaps when they're feeling settled and then having to be put into a different, say that I'm thinking about with a child, bullying is never a good option that come under this umbrella. As I say, that's why I think if we think of
what they've gone through as a child, those adults, I think we want to focus more on our children. And for those people who have gone through their experience, the adverse
is one of the main factors or risk factors for mental health issues, more as complex post-traumatic stress disorder. It can be psychosis, it can be substance misuse. So that's all in sort of under a diagnosis that someone might have. In terms of actually the symptoms that would look like on a day-to-day basis, that might be, again, impacts on the mood, whether that's really low mood, whether that's difficulties with anger, whether that's difficulties regulating the emotion, maybe feeling that you're one emotion and very quickly another, and it's really intense and perhaps feels out of proportion. It can also be difficulties with our interpersonal relationships. If we think about having that struggle with emotions, that's obviously going to impact on how we relate to other people.
Yeah.
So that can be, and also other things like nightmares or avoiding certain things or having certain phobias, things. These can be all linked back to the childhood trauma.
Wow, that's actually broad, and I think for the audience listening now, obviously we as parents, I think we need to watch out. If you've actually noticed any withdrawal, identify or listed earlier from your child, try and create time to keep an eye. I think that's actually very, very important. So the next question I have here is, what are the effects of childhood trauma in adults? So what are the, obviously we've talked about the signs and symptoms. So what are the effects? How does it affect individuals?
Yeah, absolutely. Well, with a lot of mental health issues, there's a lot that will have already sort of shown itself by age 14, 15, and actually a good 75% of mental health issues seem to sort of start before the age of 25. So, although we're talking, what I was talking about earlier, it does start from a young age. It can then kind of come into later on in life. So that all those things I listed still do apply, but that then will have an impact perhaps on how an adult would function. So, whether that's not being able to sort of complete the education they wanted, or maybe having struggles with maintaining employment, maybe even relationship breakdown, and effects on sort of even homelessness. We know that those who are homeless or find themselves at risk of homelessness, there's often childhood trauma there as well. So it can be quite far-reaching in terms of not just a formal diagnosis, but actually on a day-to-day how people can function. I think when you touched on people saying that they feel like things are still fresh, even though they're sort of 20 or 30 or maybe even longer ago, is that comes back to the theory behind how trauma memories are processed and how they're held in the brain. So if you think about just I think your listeners out there, if you think about perhaps just going to the shops last week and how that memory is in your brain compared to perhaps some of the trauma memories you have, they'll be very different. And the trauma memory, you'll be quite raw, or I often call it spiky, because it feels quite visceral, quite intense when it's brought to mind. And that's actually your brain trying to protect you. It's saying, right, this is too difficult for me to process, I'm just not going to touch it, I'm just leaving it alone. But what that means is that it feels like it's fresh, it feels like it happened yesterday or moments ago, even though it might be 20 or 30 years ago. And so that's something I really want to, if anyone's struggling out there with this, that difficulty of dealing with those memories is difficult enough. But the added difficulty to that can be that you're beating yourself up thinking, I should be over this, why can't I manage this, it's so long ago. And actually, to your brain, it's not, because of how it's formed that memory or kept that memory in its form. It's like it happened minutes ago. So I want people to know that if they're struggling with this, it's understandable. It is actually your brain doing it's the thing it thinks it needs to do to help you. But obviously that can cause other issues.
Wow. That actually makes me to, I'm going to deviate a little bit, because you just made a very valid point here. In terms of your brain telling you understand. So, back in some certain countries. So I'm going to use my own country as an example. Back then, back home, if you're really, really scared of going out in the dark, especially when wherever you're being sent to in the night is dark and you don't feel safe, it's been seen like you're refusing the errands rather than acknowledging the fact that you're feeling unsafe. You understand? And because maybe wherever you need to go, maybe you need to go through a dark tunnel or pass through, or you feel insecure, or to go through certain things. But for us, and I think the more we'll learn about these things as parents, it doesn't even have to be parents, reflecting back, I was actually, because our parent then will say, he or she doesn't want to go, and you're being pushed to do, and you understand, and you're checking yourself like these are things you probably want to do during the daytime, but because it's dark, you don't want to go through that corner or wherever you're being asked to. And then because of the weather, even here now, I think in England, I think I can remember sometimes when you ask kids, if you have asked them to do certain things, maybe in as much as you maybe go to the garden during the summer winter period that is going to be dark, you see they say, oh, I don't need it. I don't want to go, because they're avoiding to actually go on their own. And I think those little things really matter, that will take notes and validate our children's concern. So now we've talked about the effects, you understand. I just want us to look at the statistic and the link, because, you keep answering the question and linking it to mental illness. So what are the statistics of the childhood traumatic experience of a child? Because almost, let me use the word almost, when we both used to work in access team, almost every patient we assess that has mental illness, by the time you go to family history, there is something lying there for you to unravel. Something has happened that has led to, you understand. I'm not saying some people don't develop mental illness without having traumatic experience. I'm just saying the percentage. So let's go into the statistic of childhood experience linked to mental illness.
Yeah, absolutely. Yeah. So if you have experienced childhood trauma, then you are something like 3 times more likely to develop depression than the average population, and but sometimes up to 6 times as likely to develop psychosis. So it is a really big area, and I've seen again statistics saying that of any a population that were under a mental health service, those that had diagnosis of depression, 46% had childhood trauma. That's probably an under-representation there, under-reporting, but that's a big chunk. And as you say, as you've had plenty of experience within mental health services, you know that, as you say, it's often, if not always, there as a factor that's feeding into this. And it also, as I say, it impacts not just the mental health diagnosis. You're more likely to struggle with employment, more likely to be homeless, much more likely to be a drug user or be abusing alcohol. So all these things are a big factor in childhood trauma. On the flip side, though, if we go, unfortunately, the actual likelihood of experiencing childhood trauma is actually quite high in itself. Some report as high as 60% of children will have experienced trauma in their younger years. And that's really important to recognise, because that's a big chunk, but that doesn't mean every one of those is going to go on and develop mental health issues. Also to show that actually it does happen a lot, and as I say, a lot of, if we think about that definition I was using earlier, there's lots that come under that are just outside of your control, outside of any family's control. So it's often there's an element of trauma that there isn't necessarily anyone's fault. There could be the best of intentions within a family, and it still can happen. And also, it doesn't necessarily mean there's going to be a definite mental health issue from it. There is support and interventions out there to support people with this, so that it doesn't have that huge impact.
Thank you, Amy. And I think I'm going to open the line because of the nature of the topic we're treating. Because obviously the whole idea of bringing this topic out is for people to be able to share their experience, get support, and then we encourage people to call in anonymously. You don't have to mention your name if you don't want to, we just want people to get the support that they require. So the number to call is 079 353 18757. So you can call in, normally we probably will hold on to the calling before, but because of the nature of this topic, people might want to have 1 or 2 things to say, and obviously sharing an experience, a childhood experience, so that we are able to accommodate a lot of things. So please feel free to call in and ask your questions. So please, one of the admin, can you put the number on the Facebook? For those people listening on the radio, the number is 079 353 18757. So the reason why we actually, like I said, I was asking about we should talk about the link between mental illness is that, recently, I think there was a case of an individual that, every intervention given was not just working. Every intervention given, medication, therapeutic intervention was not working. And, like you and I know, sometimes it take maybe they're given like 8 slot of therapy section. Maybe in the 4th or 5th, that's when they start opening up. When the therapy is coming to an end, it takes a lot of time for people to trust you, for you to gain their trust, for them to start opening up. After a while, then the individual started talking. Then we realized, we were not even touching the source of the problem. The original source of the problem was the traumatic experience this individual went through as a child, and I think the individual, it was actually so bad, it was sexual abuse as a child, and it happened, from a relative, and I think this individual saw the person recently, and then it kind of triggers the past, what's happened in the past, and obviously there's this shame of, I didn't share with my husband, and don't want people to know. Even my family did not know about it. So obviously, and this individual was, dying inside. And at the end of the day, until this individual was able to bring out the real source of the problem. So is there a way whereby, because I'm thinking in my head, just only if this individual has opened up from the beginning of the therapy, maybe we will have, because at the end of the day, they have to end the section and have to put this individual back on the list again. And the drills, there's a long waiting list. And I'm just thinking, is there other intervention available, for people who have actually gone through, whether physical, whether bullying, whether whatever, especially from their loved ones?
Absolutely. And thankfully there is a lot of interventions out there. I think even services are moving more towards what is being classed trauma-informed care, which is, again, starting from that basic, that there will be some trauma somewhere along the line, so we can see things through that lens. And that's why perhaps, as you say, there is that experience that it can take people a while to open up because of the impact that has had. If it's something where someone has done something that to you, then learning to trust other people is going to be particularly difficult. Adding in on top of that, perhaps any societal or cultural expectations of what should or shouldn't be happening, and the shame that can come from that, that again can keep anybody from speaking up, which can again mean that people have just kind of holding it themselves, and creating their own understanding of what's happened to them, rather than perhaps being able to share it with others and work through and understand that what happened to them wasn't their fault, wasn't anything that they could do, wasn't because they were bad, wasn't because they were wrong, but was just something that's happened to them. And that's the key point. If we can start thinking about, it's not about what's wrong with anybody or what's wrong with someone, but what's happened to them. What's happened to them, and why is what's happened to them impacting on today? And in terms of what their behavior is or what they're struggling with, 9 times out of 10 will have a purpose to it, will have a meaning. It's some way that the brain and the mind is trying to look after us as best as possible. So that's why it can be difficult. You can find that struggling to open up. But alongside that is it can take time. So even if there is an experience of struggling to open up in therapy, you can still get a lot of benefit out there. It might not be that there's going to be one thing that fixes everything. It might be that all of those things need to come together, like medication, like therapy, like looking at outside of the therapy room, what's that going to be like? Because if actually we're asking people to expose themselves to the trauma that they've been through, that's really tough. That's really tough to ask them to think about those terrible things that have happened to them. So we need to think about what skills and strengths they need alongside that. So actually, if if you're not having a sort of a routine or a sort of day-to-day life that includes some things that make you feel like you have a sense of purpose, or that you feel like you have a bit of fun, then asking someone who has absolutely nothing in their routine to think about their trauma, that's going to make anybody perhaps worse rather than better. So it might be thinking about things about outside of the therapy room before starting the therapy.
Wow. That's actually another valid point, because I think some people are scared to open the wound.
Mm-hmm.
So
Yeah.
how do we then get healed if the wound is not being open, if we don't talk about it? And if you look at it from the angle, that's a very valid point, because you want people to go back to the past. What if they get drowned in the past? Because it's going to bring fresh memories of past, sad memory. But at the end of the day, it's somewhere there hiding, isn't it? So then what do we do then to make people to open this wound so that they can get support?
Absolutely. And it is there is a lot that people will do to try and minimize the impact that those experiences have had. So we need to find ways to replace the things that aren't helping, which might be about drinking or drugs or self-harm or avoiding certain things as a safety behavior, and get them to think about and help them, support them to find other ways that are going to help them cope with the memories, cope with the impact. Because if we just go, no, stop all of that, that's not helping you. That's then just leaving them alone with really difficult memories, really difficult emotions, really high distress. So the first thing is thinking about how are we going to look after a person to be ready to be exposed to some of those difficult emotions and difficult thoughts. And that might be thinking about how do you soothe? Do you soothe? What is it that you do to look after yourself? And if that's drinking and drugs, then we need to think about what's not going to be harmful in the long term. So that's things like, it might be about exercise. Although they might not think of that immediately as a soother, we know it's really important actually to get a good amount of exercise to deal with trauma, because of the impact it has on the body. It's burning of cortisol, which will probably be quite high in those that have unhealed trauma, because of the stress of the memories is just pumping that chemical around them. So that the exercise will burn off that. It'll also bring in some endorphins, which will make you feel better. So actually, exercise can be a way to soothe and cope with some of those memories.
So I'm going to be reading, somebody just put something in the messenger. So obviously, and like I said, we did acknowledge the complexity of this topic. And I'm just going to read the message from the inbox, And yes, so how can exercise heal sexual abuse that I don't want to talk about? That's actually, over to you, Dr.
Yes, absolutely. Now, it's really important to say that exercise isn't going to make it all better. This isn't about that. It's thinking about what's going to support you, as you say, to start talking about the things that are difficult to do. It's going to be really scary, actually, to start talking about those things that have happened. And it might even be painful to do so. So we need to think about how can we manage it? How can we best equip people to feel supported to open that wound up? And ultimately, we want to be able to help them heal that wound. But it does mean perhaps digging around a little bit. So the exercise isn't going to heal that, but it might be about supporting you to have those skills that can manage what's coming up as you're digging into this trauma. I often think about therapy as the analogy I use is cleaning a room. You think about cleaning any room, you kind of has to go through the stage of getting messier before you start putting things back in a nice, neat way. But what you're hoping to do is that when you put things away nice and neatly in that cupboard, that when you open the door, it's not all going to fall out on you. And that's the idea behind sort of therapy, is that there is going to be a bit where it gets a bit messy. It gets hard because you're looking at things that for very good reasons you've tried not to. You've tried to pack it away and push it to the back. And we're saying, bring it to the forward. Let's have a look at it. let's see how we can better understand it from an adult's eyes. Because that can be really helpful in a therapy when we're thinking about things that have happened to us as children. How can we now look back on it as an adult and go, oh, there really wasn't anything I could do about that. It really wasn't my fault. And that can help healing. So when I'm thinking about these ideas of soothing, it's not about healing that. It's about supporting that really difficult process that can take time.
Thank you so much. So I'm actually responding because it's actually a bit hard when you have to. And like I said, I do understand the severity of this topic, So, but if you can, the number to call is 079-353-18757. You can call in, to ask your question, and obviously, if not, we'll read your question out on the, if we can, as much. And if not, after the show, I'll get Dr. Maurice Foreman to respond back. I actually this is actually just me thinking based on what you just said, that is it possible for somebody not to actually want to talk about trauma and just get healed like that and put it in the past? You understand? Is it possible?
It can be. I would say 9 times out of 10 probably not, because actually, as I say again, if there is this reluctance to look at it, again, it's probably around the reluctance to be exposed to any distress, any difficult emotion. And when that's the case, actually we tend to find that there's difficulties in day-to-day life, because we're all human. We're all going to feel emotions at some time. They serve a function. We need to feel them. And if actually we're avoiding them for very good reasons, in terms of that there's trauma, unprocessed trauma around, then it's unlikely that you're going to be able to manage emotions in your day-to-day, because when we avoid everything. And actually that can be avoiding the good and the bad. So when we're trying to avoid feeling any emotion, it might actually also be that you can't feel excitement or happiness or connection with others. So it's, I would say, to actually process the trauma, you need to look at it, because often, as I say, it's helping that memory be processed by actually looking at it. It's also helping you learn that you can tolerate this distress, you can tolerate these emotions that come with it, that it's not going to destroy you or end the world, and you have the skills, which then allows it to move into a different form in your brain, and doesn't, as I say, not so spiky. It's never going to be a memory that you're going to look back with fondness, but it's not going to have that same raw painfulness that comes with it once you've actually been able to look at it. But it might take a long time to get there. As I say, a big part of my work is actually the stuff that happens before we start talking about the trauma. It's looking at those skills and strengths that people have that we can bring to the therapy to help people with this difficult work. And it's also helping people understand why we're going to be looking at the trauma. It's not a case of I'm nosy and I want to know all the details. It's generally because we want to help this process. And if you don't understand why your therapist is asking these questions, it will just feel like, oh, you want to upset me, you want to expose me to this distress, without having an understanding of why we're going there. So there's a lot of work that gets done in therapy that's not about talking about the trauma directly, but getting the person to a place where they feel safe enough to do so. And as I say, part of that might be about soothing, but it's also about that idea that you touched on earlier, Elizabeth, in terms of shame, and thinking that you should be over it, or that it shouldn't bother you as much, or that you could have done X, Y, and Z to stop whatever happening to you, or that all that you're struggling with means that there's something wrong with you. And I really want to stress this point so much, is that it's not what's wrong with you, it's what's happened to you. And we're going to try and find a way to understand why that's impacting on you now. Because those experiences as a child has informed what you think of the world, what you think of other people, and what you think of yourself. And when we can understand how that's influenced that, that's when we can start to challenge it and change it.
So in a way, does it affect self-esteem then
Absolutely.
and trust?
Absolutely. Yes, absolutely. Another way to think about trauma is thinking about it as an invalidating environment. And what I mean by that is where there is something that's made you feel a certain way, usually anxiety, usually fear, and you're expressing that and it's not being listened to. It hasn't stopped it. And so that means that you can think, well, did I not did I not express it clear enough? Am I not worth being listened to? Am I wrong to have felt that in that situation? And that's obviously going to impact how you feel about yourself. So it can absolutely have those impacts about whether your self-esteem, whether you trust others. Well, I expressed how I feel and I wasn't listened to, so other people are unsafe. Or it can, as I say, think about that world. This has happened to me. This is likely to happen again and again and again. That's going to make you think that the world is unsafe.
Thank you so much. I think I can actually relate this. I was talking to parents to be very, very, a bit careful and observant with their children. There was this video that went viral a couple of days on social media, Instagram, that this particular school in the state in Nigeria that they did I think they I don't know what the kids did, and they were being punished. Obviously, the nature and the law is different from different countries. So it is not like it's right, but it was allowed for teacher. We're going to pick this call and we'll carry on.
Absolutely.
Hello, you're welcome to today's program.
Hello, good evening. Hello, Labake, and
Hello.
good evening, Dr. Amy.
Hello.
Listening to this topic, childhood trauma, my view is if someone has experienced something very traumatic as a child, and now speaking about it as an adult, it does have its impact, because I've had some friends that went through traumatic experience while they were children, and going through counseling. They had to relieve it, but this made it really, I think it bringing up the old memories made not a positive impact, if I may say, because the person tend to relieve the childhood way of relieving the stress, like self-harming again. So yeah, this is, I know it does have some, not just okay, I've had, like I said, I have some friends, one didn't take to this to read well, while the other, it did have a positive impact, because although she broke down, she went through all the emotions and even some unconscious issues that she subdued, that she's buried, and she never knew she, ever existed. So it did help her to remember, and just she's healing, because like you said, it doesn't heal completely, but she's healing. So what I'm trying to say is the contrast, because it did work for one while it didn't for another, and to the other it made the person go back to, and it made them probably, maybe she didn't go back. But my question here is, how would the one that had to go back and self-harm, how would she heal, or what could she do to make things better? And rather than relieving the past, what can she do to alleviate this trauma?
Absolutely, yeah.
That's a very good
and
question.
that's definitely something. Absolutely, and definitely, I'm sure other people can relate to that experience of different outcomes or different experiences within counselling and therapy. For me, it highlights what I was saying about that the importance of that prep work. For want of a better phrase for that, is making sure that the person when they're asked to relive that trauma, understands why it's being done, what we're hoping to achieve by doing that, and also feels safe to do so. And alongside that, knows that when they're reaching their limit, that we all have a limit where we just become totally overwhelmed with distress, that they know that they're with a suitably trained practitioner, to know that what can happen is dissociation. So they're not really feeling like they're connected to the moment, to the place that they're in, and nothing. And there's no point carrying on a therapy session at that point. You have to stop. And you have to help that person ground back into the moment. Right? So that's really, really important, to be able to do that and feel safe. Otherwise, there is going to be ways to try and cope with that extreme levels of distress, that overwhelm, and one of them might be self-harm. And I think having an understanding of what self-harm might be trying to do can also help, again, with that idea behind the shame and the not, why do people do that, is that it's easier the theory goes that it's easier to deal with the physical pain that's created by the self-harm than it is for the emotional pain. So in a way, that person is trying their hardest to deal with what's going on and look after themselves. So obviously in the long term, that's not going to be helpful. So it is about finding what else other than the self-harm is going to help in those moments when the distress is so overwhelming. You just need to address it. One way is actually, rather than self-harming, wearing an elastic band around your wrist and flicking it. So it's having that same fact that it's a sharp sensation which brings us back to the moment, but it doesn't do long-term harm.
And there's no the skin is not exposed in a way.
Absolutely. Another way might be to try ice or really cold water, because often when people are feeling that level of distress, we feel hot. And so actually doing the opposite kind of sends your message to the body, well, you can't be that distressed because actually you're not that hot anymore. So it might be about holding an ice cube or splashing your face with cold water. So as I say, it's that importance of finding that putting those skills and those strengths in, so that when the distress starts to creep up, we know how to bring that person back to that moment, rather than carried away by those memories. And say for your caller, for your friends, that there's that, but also to keep hope that there's other factors at play with therapy. It might be that there was other things going on in their lives that meant that the therapy wasn't at the right time. When you have to deal with other things going on, therapy is hard work.
It is.
So if you're having to deal with other life stresses, it might not be the right time. It also might not be the right fit in therapists. We know that has a really big impact on the outcome of therapy, regardless of model that's used, is actually feeling connected to your therapist. And I think that comes back to that idea of feeling safe. You've got to feel safe in that space with your therapist to be able to expose yourself to that distress.
And I think quickly, I learned something in what you just said. And this is actually to all we professionals out there, because obviously I'm going to reflect back, to when we used to work in the certain place where we assess the patient. And we have a time frame, You have to see a patient within an hour. You have to do your notes, Sometimes you assign a certain number of assessment. And I think this is actually for we professionals out there to make sure the patients are ready and not in rush, to ensure, because we are all guilty of this. We just want to quickly do the assessment, and we're checking anything that needs to be aware of, any family history, any dates, and you want them to say yes or no. Meanwhile, people, and sometimes they're not ready, like you rightly said. And I think that's actually something for us as professionals to digest and be conscious of the body language, to ensure they're actually ready, to talk about whatever, because it's very important for them to feel safe, And like the caller said, you don't want to come to a therapy and get home, which I've had people said, and feel worse, because at the end of the day, I've had some patients who say they came out, they were okay when they were there. So that means they were actually not connected to the model of the therapy. So they were only there to hear the therapist talking, you know. So I think it's very, very important for we professionals to ensure our patients are ready. They're in that same level with us to actually, and I think it's actually something you see, that's why we say it's a discussion we whole lane, you know. And God help us with the system, you know. The system is so structured in a way that, you know, certain doctors are booked to see certain clients, you know. And that's why when you go to your GP, you know, it's 15 minutes, everything. Just rushing to say whatever you need to say, you know, and rushed out, you know. They rush you in and rush you out. And I think it's something for all the professionals online, because I know we have quite a lot of professionals online, you know, for us to kind of meditate in dealing with our patients. You know, we need to ensure are they ready to talk about this. And even if they were ready and they stop, like Dr. Maurice Foreman said, let's stop. We stop the therapy. We don't have to make sure complete it. You know, we don't have to carry on when our service users are not ready. That's actually very, very important. And like I said, you know, there are quite a lot of messages on the Facebook, which probably we'll attend to at the end of the day, because I can't keep juggling to read. But if there's anything, you know, anybody wants us to if you want to discuss anything privately, you can send an email to info.yourhealthmatters@yahoo.com. info.yourhealthmatters@yahoo.com. We'll always respond to your call, and you can always call in. We still got a few minutes. 079-353-18757. You know, so let's continue with the conversation before the caller called. So the Instagram, and this lady came on Instagram and talked about a child, you know, the group of kids did whatever in the school, and the child were told to punish them. I don't know whatever anybody can, you know. A particular child was given 164 strokes of cane, beaten. Obviously, you know what cane is, whip, you know, and was beaten, you know, 164, and the child, you know, obviously, I don't know, well, at least according to the reports, the child was unwell for a couple of days and died. This child passed away. While everybody was, you know, focusing on, obviously, nobody wants to lose a child. Even if the so-called teacher is expelled, jailed, imprisoned, which, you know, it depends on whatever, you know, how connected or whatever that happened, the parents are, because it was one of these activities that actually brought it to social media. You know, they were going to cover it up. Somebody heard about it and exposed them. And I'm thinking in my head, this individual teacher can't be normal, can't be okay. Because if you hold a child, a whip or cane, and you're beating somebody, and this individual you're beating are expressing pain, for goodness sake, we're human. How are you able to carry on beating a child, somebody else's child? So I'm thinking in my head, what could be happening in this individual? This person needs to be admitted in mental health hospital, period. You know, this person is not normal. This individual is definitely not okay. Something is not right somewhere, because how can you? Because sometimes, and that's why, when people have issue growing up, they transfer the aggression on other people. And that's the point I'm trying to make here. Because if you're a happy person, there's no way you're going to look at a child, irrespective of any system, irrespective of any thing that child, you know, must have done, you know. Even in UK, yeah, there was a time, you know, a child pulled, they were in the playground, they were fighting, and pull, you understand, the other child's hair off, pull it off, you know, rip it off. And at the end of the day, I'm thinking, what is happening in that child's head? Because it will take a bit of energy, isn't it, for you to pull and extract, and, you know, this is UK, this is actually, you know, and I'm thinking, what is actually happening? You understand? And by the time we get into the bottom of the issue, this individual child has been constantly been bullied. We're going to pick the call and we'll come back. Hello.
Hello.
Hello, you're welcome to today's program.
Oh, thank you so much for the program. I just have one question to ask. So, are there any common physical health issues that are associated with childhood trauma?
Okay.
Mm,
Okay,
that's a
thank
really,
you.
really
That's
good question.
okay. That's yeah, go on,
Talking
doctor.
about the impact of physical health from trauma, absolutely. This is an area that's sort of growing in terms of what our understanding is. It's not clear yet completely, but what we do know is that there can be impacts on our physical health when it comes to trauma. So things that we know that can have an impact or can be interacted with in terms of mental health issues and physical health is anything that you think of in terms of knowing that it's impacted by stress. So that can be things like irritable bowel syndrome. It can be sort of migraines. It can be stomach ulcers. It's lots of things that can happen in our body because actually, and lots of perhaps if you think about medically unexplained symptoms also has that can be a risk factor is childhood trauma. Sort of chronic conditions. There's supposedly a psychological factor to lots of sort of longer term chronic conditions. That's not to say that that's the only reason, but that there is a part of that. And the kind of the mind body link is our understanding of that is growing day by day. You know, things like we have neurotransmitter receptors actually in our digestive system, so that you know we there is that feedback there. Again, if I think about when we think about cortisol that I mentioned in terms of exercise, we know that when there's too much of that in our body, when we're constantly exposed to that, that can cause other physical health issues. Again, like the irritable bowel syndrome, that can impact our again headaches and pain and other pains in our body. When we have too much exposure to that, can impact our blood pressure and things like that.
True.
So there's a whole range of physical health impacts that it can have when we've had those experiences. And I just think we'll have a better understanding as the years goes on about how those two interact with each other. There again, there's some theories that for some people it comes out in a physical health condition rather than a mental health condition because that's perhaps how they better understand their pain. Is that for them it makes more sense for them to come out in a physical way than perhaps in a mental health issue.
Thank you so much. In fact, thank you so much, Dr. Amy, for that. That reminds me, I'm just going to deviate a little bit. Tomorrow, there is actually a mini health check for adults and children, you know, and a bit of activities. Obviously, the kids are on holiday in UK at the moment. And so there's a walk-in for anyone living around Barking and Dagenham. Ilford, they're staging a walk-in mini health check for adults and children. And I think, you know, if you're actually available, you know, I'm aware of the one happening in Barking. There's one happening 10 to 4 p.m. at near Barking Market next to McDonald's and Asda. You know, there's no appointment needed, you know, you just walk in, you know. So please, you know, make use of this appointment. These days, the GP appointment is so hard to come by. So if you're having people doing a walk-in mini check, you know, take your kids there. There's no harm, you know, in you just having physical health. They do your vital signs, you know, they check your systolic, your diastolics, your pulse, you know, your saturation. And this basic observation, you know, this thing, you know, they actually can help to detect if something major is happening that you're not aware of. The fact that you're, you know, ill and hearty, you're going around, you know, doesn't mean everything is okay. The fact that you're skinny or you're big doesn't mean everything is okay or nothing is, you know. So just if you know, if you're around Barking and Dagenham, Ilford, you know, for Barking, they have 10 to 4 p.m. near Barking Market next to McDonald's and Asda tomorrow 10 to 4 p.m. And for everyone, you know, I think the last caller opened my eyes and understanding to the fact that, you know, there are quite a lot of people that have ongoing physical problems like diabetes, cancer, high blood pressure, you know, rheumatism, you know, obviously, you know, the pressure, the pains and everything could cause trauma, you know, because obviously they're not having quality of life. And all this, you know, could attribute to when you, and some people are on a long-term medication, you know, every day having insulin, you know, having to have a certain number, and this affects the quality of life they do. But the point we are making here is, before, because our time is actually well spent, whether you have a childhood trauma, you know, whether you're experiencing a trauma currently, you understand, I think the bottom line is like acknowledge there is a problem and seek support as and when you're ready. Don't leave it too late as well, because at the end of the day, you know, sometimes things might actually, a little things will happen and it will bring out too much, you know. And that is why you see that sometimes you're driving, somebody, you know, just overtake you, and they are actually the same person swearing. So a little things could actually aggravate it and explode, make you to act in a way that you probably wouldn't actually. And some people will end up resulting into alcohol, drug taking, you know, and you know, these things, they're not going to help. They're going to cause more harm. They're going to cause more danger. So I think the bottom line, the reason why we brought this is that we all have one trauma or the other. And the important one that we always neglect is environmental. Sometimes the abuse is not outside happening to the children, they're within. A home whereby the parents are always fighting, you're exposing the kids to unhealthy, you know, lifestyle. A home whereby, you know, whether, you know, the aunt or uncle, you know, there are quite a lot of things, the environment, you know, there are quite a lot of environmental factors we need to open our eyes, you know, to be aware of. I'm not talking about the country, the system now. I'm talking about what we can handle. And I think if you notice any relapse or if you know your child is actually withdrawing, you know, it doesn't have to be school, maybe activities, even whether food, maybe you're thinking they're spending too much time on a particular thing, you know, keep an eye. Keep an eye. Especially our youths, the adolescents, they don't like talking. But, you know, if you observe, you know, just tell them whenever you're ready. I normally tell my girls, you know, they're obviously adults, you say, whenever you're ready to talk, I'm here. You understand? Whenever you're ready to talk, just know I'm here. And then let us make ourselves, you know, the way we grow up, you would dare not go and, you know, that opportunity we know there. It was too strict, you know. But fortunately for some of us, we came up from a background whereby we are allowed to talk. We can talk to our parents. We're not scared of, I'm not scared of my dad. I'm not scared. So we have that open relationship, you know. So even living, you know, back home. So we still have that system in place whereby some of us can still emulate, ensure, you know, and make sure we make ourselves a safe space for our children, you know. Always think about yourself. And for anyone going through any, you know, trauma, you know, even we are going to winter now. You know, the weather itself is actually, it's going to be depressing. Excuse my language. It's going to be depressing, you know. Whether you're looking after a loved one who is actually going through a lot. Remember, you can get support for yourself. There's care at assessment. You don't have to be unwell before you get up. If you're living in UK, wherever, you know, there's quite a lot of support out there. So I just want to say thank you to Dr. Amy Morris Foreman. This is the second time she's coming. I think the last one you came was a couple of years, maybe 3 or 4 years ago. You understand? Thank you so much, because, you know, these people, I always say to my audience, we don't pay them. You know, they come on the show to share their knowledge, you know, to impart. And to all my viewers online and my audience and the caller, I want to say thank you. Without you, there is no, you know, host. We can't be talking to ourselves if there's nobody online, you know. This is our little way of supporting the community, you know. In this period, you know, make sure, you know, whatever you think is actually not making you happy, move away from it, if it's possible. And if whatever that's not making you happy is within, manage yourself in a way that you prioritize your mental health, you know. You have to be sane. I keep telling my audience and friends and everyone. You have to be sane to look after your children. You have to be sane to look after your husband or your wife. You have to be sane. So it's safety first. So I hope we'll see everybody next month. So a big thank you to my husband, the CEO of Dignity Radio Station, for your support. Thank you so much, babe. And a big thank you to my admin, my girls, Adra Gbemi, Ayomide, and to all our callers. And I've said, till we miss next month or whenever, stay blessed. Remember, your hope matters. Bye.